The overwhelming case for a racial difference in the burden of lung cancer, which is the greatest cause of preventable cancer deaths in the United States and worldwide. African Americans suffer from lung cancer more than any other population group in the United States. They are more likely to get it and more likely to die from it. African American men in particular are at increased risk. They are 37% more likely to develop lung cancer than white men. Even though their overall exposure to cigarette smoke, the primary risk factor for lung cancer, is lower.
Not only do African Americans get lung cancer at higher rates than other groups, they are also more likely to die from it. African American men, who are the most risk of any group, are 22% more likely to die from lung cancer than white men. The average length of time that African Americans survive after a lung cancer diagnosis is also lower. Only 12% live longer than 5 years, compared to 16% of whites.
An analysis of the 2005 Health Information National Trends Survey found that while all races grossly underestimated the lethality of lung cancer, Black patients appear more confused about prevention recommendations, to doubt the association of cancer with smoking and lifestyle, and to be reluctant to seek preventative care because of fear of the disease. Studies have shown that equal treatment yields equal outcome among equal patients, but the sad truth is that not all patients are equal. African Americans get diagnosed later when their cancer is more advanced, wait longer after diagnosis to receive treatment, are more likely to refuse treatment, and are more likely to die in the hospital after surgery.
African Americans in the U.S. do less well by most measures of socioeconomic status than do whites. Approximately 40 million people, or 13% of the U.S. population, live in poverty. Compared to 8% of whites, 24% of African Americans live below the federal poverty threshold. In this chart, you can see that the number of patients who have lung cancer and are African American is 12.6, and the number of patients who have lung cancer and are white is 15.2. White patients are more taken on than African Americans. This chart shows the number of new cancer cases. It shows that African American men have 91.5 new cases of lung cancer per 100,000 people. The chart also shows that white men have 68.4 new cases of lung cancer per 100,000 people. As you can see in this chart, African American men have 95.8 per 100,000 incident rates for lung cancer, compared to white men who are non-Hispanic who have 79.1 incident rates of lung cancer. This chart shows cancer death rates. African Americans show the highest death rate of lung cancer, with 78.5 per 100,000 people. Whites have a rate of 65.7 per 100,000 people who die from lung cancer. This graph is showing lung cancer incident rates by race and ethnicity in a U.S. census and based on region. As you can see from this graph, African Americans have the highest amount of lung cancer incidents in the Midwest compared to any other region in race or ethnicity. The rate of lung cancer incidence of the Midwest is 88 per 100,000 people.
This graph shows the lung cancer incidence by sex and by race ethnicity. It shows that African American males have the highest rate of lung cancer throughout other race ethnicities and sex.
As we move into an era of health care reform and health equity, too many cases, too many deaths, lung cancer in African Americans can provide a stimulus for revitalized efforts among individuals, healthcare providers, researchers, community-based organizations, the business community, and all levels of government.
Lung cancer kills more African Americans than any other cancer. Smoking is the leading cause of lung cancer.
But if you come down with lung cancer, it's not the end of the world. There is plenty of good service out there. You need to access it, and you gotta stay positive.
If you look at African American males, if they're smoking exactly the same amount as their white counterparts, they're still 50% more likely to end up with lung cancer than their white counterparts. There are several theories behind this. One theory is that African American males go to the doctor a lot less frequent than their white counterparts,